from professional athletes to weekend warriors, every year more than 100,000 people in the United States have surgery to repair their shoulders. Unfortunately, some repairs fail or just don't get good results.
Now, a local doctor has helped develop an innovative new device that could be a game changer. Down on your side, Stephanie Hudson shows us how it helped one local patient get back to the gym doing what she loves. Stephanie?
Well, Len and Tom, Dr. Kevin Bonner developed the device with a colleague from UVA and another from Los Angeles. They all worked with engineers at Johnson & Johnson to take this idea from Hampton Roads to doctors across the country. Here's how it works.
This is the actual implant itself.
It's the brainchild of Dr. Kevin Bonner, conceived after 25 years of performing good surgeries, but always searching for perfection.
We're hoping that the Titan is going in that direction.
Fitness buff Danya Boucher got the implant in January.
I have been active for years and years and years at my gym, lifting weights, and my shoulder started bothering me a few years ago.
Boucher had a torn bicep and some understandable anxiety about having it repaired.
My husband tore the lower part of his bicep tendon many years ago, and when he had it repaired, a week after repair, it ripped again.
Bicep repairs can fail for different reasons.
We have issues where we fix the biceps in one location and it actually slips down and doesn't heal where we put it. The other thing is that sometimes it just pops.
Bonner blames the screws they use, which often shred the tendon and cause damage. His new device, he says, avoids damage and optimizes healing. He showed us how.
This is making a little tunnel.
He goes into the shoulder arthroscopically, makes that little tunnel, pulls out the tendon, and attaches the device.
And then we're going to just tap it in.
These little flanges expand inside, so it stays put.
So that's what makes it unique. The tendon is not damaged. It's in a tunnel. And basically, it's an optimal healing environment.
Boucher was back in the gym after 8 weeks and healed within 6 months.
Deadlift is my favorite, and so the other night I did 4 reps of 180.
And though Bonner admits he may be biased,
honestly, the results have been great.
He believes this is the next best thing in shoulder surgery.
Dr. Bonner himself has used it in 143 shoulder surgeries and 2 knee procedures since January. He also helped design a collagen-based suture, which is designed to help soft tissue heal after surgery. That has just recently been approved by the FDA. Stephanie Hudson, 10 on your side.